There we go. My phone was gross. So we're live on TikTok, Facebook, YouTube. Um, Neil is with me on YouTube and Facebook.
Hi,
You can hear
everyone.
his voice. Oh, there he is. He's here on TikTok, but unless you go to Neil Hyzak FNP and follow him, he will not have his face on TikTok. So you will see him at Watch AMS. You will see him on the Facebook group, which is amspublicgroup.com. You can go to either one. Let me pull up the chat so both chats will come through. Um, so what we do here is we talk about lifestyle medicine crap. We talk about GLP1s, which are semaglutide, tirzepatide, liraglutide, Saxenda, Wegovy, Ozempic. Let's see how many people. Let's see how many filters we can tick off. Zepbound, Manjaro. Did I say Ozempic? I did.
You did.
Anyhow, all those things and kind of. So this is not medical advice, right? This is not medical advice, not financial advice, not legal advice, and definitely not relationship advice. So what we do here is we answer your questions. If you are our patient and you are on here, doesn't mean that we are your providers on here. We are doctors and nurse practitioners. We are not doing that here. This is social media. We're here to be social. So if you are a patient, you get to go to our private patient live, which is also in a group setting, but a safe group setting. So it's not public, no trolls, no nothing. And feel free to troll, I can block you. It's all good. No, just kidding. Negative
Yeah.
comments are also welcome.
Heck yeah. We don't get enough trolls. What's up with that?
I know, right? You haven't made it until you get hate. If they don't get it, the haters. So please feel free. Hey, look, we have another Maureen on there. How cool is that? It's obviously, and you know this, it's a name you don't see very often. So anyhow, yeah, give the live some likes. I don't know what it's asking me to do. I have a red dot and I don't know what the dot is. So sorry,
What'd you
whatever that
do?
red dot is. It's a notification that I don't know what it is. Anyhow, so yeah, ask us questions. You can either type it if you're on Facebook or YouTube. You can type it in the chat. It'll pop up. Or if you're on TikTok, just type it in the comments, and that's it. That's what we do. All right, Neil. We had talked about something today, and I said we need to do this on the lives. And what was it?
I should have wrote it down.
I know. I thought,
I
oh, I'll
do
take
that
a
now.
second. I'm like, don't take a second. Write it down. We have a space for that. We have a system for
Ooh,
that.
we do. We were talking about something. It wasn't pertinent to what we were meeting about before, but we were talking about how people are having trouble with the card.
Oh
Apparently,
yes,
it's a ransomware attack. For
seriously.
yes, blame for the change in healthcare outage. It's affecting a couple people. So yeah,
That's interesting. Well, this week I woke up to two text messages from, thank God for Reddit, right? For ATM cards that I have never used. Like I've never used the number online. I've never used the number in person. They're for business cards. I was like, what are these cards? Because it gives you the last four digits. And I looked through and I was like, and because it was from Chase, these two things were flagged as fraud. And it was like $15 or something. It's apparently an overseas company that every couple of months decides to try to get money. And I'm like, really? Oh, that's super cool. They break into the, like we're so insecure. Not secure. That's not the right word, but you know what I mean. Unsecure, not secure, insecure works. Um, but yeah, it's all okay, great. Like, yeah, I don't know. I don't know. Anyhow. Oh yeah, and we got to the bottom of our first fraud issue, which actually ended up being kind of what the fraud issues usually are, that people knew each other before. And yep. So thanks for having that count against us. It's all good. It's all good. But that's okay. Forgiveness. She never would have done it on purpose, which is kind of funny because I was like, I actually thought to myself, I'm like, no, she wouldn't do that. Well, she didn't do it. It just sort of happened. So anyhow, that's a whole bunch of business crap. But if you're having trouble using the Eli Lilly savings card for Zepbound, it is not your fault.
it's not HEB's fault. It's not CVS's fault for once.
Yeah, for once, it's
It's
not
probably
CVS.
it's probably still Walgreens' fault, but
Right.
they're loving
God,
that.
Walgreens was tough. Walgreens was actually part of the reason I ended up doing this as a career. because when I went to, because I went to Push Health to find a doctor. No, let me give this explanation. Push Health is not a doctor. It's a big doctor's office. It's an IT platform. So doctors go there to be able to practice. Now, the cool thing about Push Health is they don't manage your practice. They don't tell you what to do. That's all on you. You got to be a good doctor or be a shitty doctor. Just they don't regulate it. Now, they regulate it from a legal standpoint. Um, but so I went on Push. Let me see if I can pin comments today. Yeah, I can because I couldn't the other day. So I went on Push, found a provider to give me I almost said Zepbound, Manjaro. She prescribed it. Walgreens did the prior authorization BS and we said no. And then I learned, I was like, what is this? So month 2, right? Everything explodes. And they're like, oh yeah, it's $150 for your provider. And I was like, I'm sorry, what? We start out at 65 and then you go to 150. And then I needed a prior authorization. So I paid another 150. I didn't care. Like at this point I had freedom with the drug. So I was like, what the frig ever? Like, I'll pay you money, especially because we were getting the drug for $25 at that point. Right. So anyhow, Manjaro or Zepbound with the savings card is $550. If you have commercial insurance that does not cover, if you have commercial insurance that covers Zepbound, it can be as low as 25. So, which is pretty
Yeah, I think
cool.
there was someone that posted earlier. They got 3 months for 25, which was awesome.
Nice. Yeah, if your insurance covers it, it'll bring that way down. If your insurance doesn't cover it, I talked to somebody this morning on Reddit that I think it was Reddit. I don't know, somewhere.
Mhm.
That's what happens. Where they were like, "No, my insurance denied it, so I have to pay 1,100." I'm like, "No, your insurance denies it, so then you pay 550." Like that's how the savings card works. Read the black part. Don't read that cute 25 because man, that I think it's a green 25 now because it used to be purple. Don't read that Q25. That's like bait and switch for some people, except for that person who got 3 months. So if you have commercial insurance, which means you can't have federal insurance, you can't have Medicare, you can't have you can't have no insurance. Cash pay cannot use coupons. That's by law. Not our problem, like not our fault. Do you still start out at 2.5? Yes. Yes, yes. Some people do not have an effect at 2.5. Some people have a killer effect at 2.5, and we don't know what you're going to be until you inject it, which is pretty crappy, kind of, because, like, I did 7.5 yesterday because I needed to break the cycle a little bit. The disastrous brain cycle. I need to coin a term for that. Yeah, this one needs to be pinned. So yes, we always start everybody low because I started at 7.5 yesterday, and frankly, I have not eaten today, and the thought of food makes me want to throw up. And I don't have tremendous nausea. It's like literally a mental aversion to food. I've done like cognitive behavioral stuff where you try to picture your food with like gross hair, like the hair out of the drain,
Oh,
to try to like produce a mental aversion to binging. That's what I have today, which is pretty funny. Never worked before. I'm just going to eat the food. Um, but that's what it reminds me of. So Federal Blue Cross Blue Shield, you cannot use the coupon. It depends if there's a supplemental in there, but usually no. Any government, and it says it right on the coupon. So if you go to zepbound.com and then hold on, Zepbound, it comes right up because me and Eli Lilly we are like this. Scroll down to what is Zepbound? Yeah, we know it works. We know it works. You don't even need any of this. We need none of this. We know it works. We all know it works. Learn how you can save on Zepbound. Find out how. It's a teeny tiny button. So click find out how. 3 steps to learn. Choose the type of insurance plan. Check if you're eligible, and then download your savings card. Terms and conditions apply. Where it says terms and conditions, that's the nightmarish crap, right? That's the big, long thing. You have to document that you are not enrolled in any state, federal, or government-funded healthcare program, including, without limitation, Medicaid, Medicare, Medicare Part D, Medicare Advantage, Medigap, DoD, VA, TRICARE, Champus, or any state prescription drug assistance program. So there it is. If my insurance was paying in 2023, but now they want a PA for Manjaro, can you do this? Yes, but it might be a waste of your money and time because they may have taken it off the formulary and they want you to beg and plead to say, please, pretty please. And so if you call them and say, I I want Zepbound, or well, okay, you're going to be nice about this. So federal employee insurance, that's different. That's different. If it's federal employee insurance, like we've got patients in Florida that are state employees of Florida and it's state insurance, then it covers, or then it's commercial insurance. So they'll tell you. They'll tell you for sure. But yeah, you need to call your insurance for the prior authorizations. You need to call your insurance company.
There's this one. What difference do you feel compared to Monjuro with the Zepbound?
Same drug.
Identical drug, different sticker on the pen, and there's really no difference between that and the compounded version, at least with the active ingredient. They just mix it with something else. All work the same. I think you've tried 4 now, right, Mo?
Yep, I've been on. I haven't taken Zepbound yet, because I just haven't pulled the trigger on paying the money. I've been on ACA, which is no longer. That's one of the compound pharmacies we used. Axtel, which we do use. Empower, which we use. Oh, and South Lake in Florida. And all of them have felt the same to me. Like today's rough. Well, yeah. I also ate greasy food. I was thinking about it yesterday, Neil, because I got too hungry and then I got stressed out, and that's a real bad combo for anybody, right? I'm not unique in that way. So I ate 3 chicken fingers at about 6:00. Still haven't eaten. I can't eat. I was up all night with stomach pain intermittently. I mean, I had brain tornadoes as well, but I had stomach pain, brain tornadoes. I was like, this is a fantastic night's sleep. So it was ugly. I have a script. Go ahead. Good. Yep, go, Tammy.
Yeah, has a script and had a prior approval for insurance, but can't find 0.25 suggestions. I'm guessing you're talking about semaglutide. Yeah, the 0.25, 0.5 are just about impossible to find. Some places can't find the 1 milligram. Typically, with our patients that have a prior authorization that it's approved or their insurance will cover it, we are starting them on compounded version until we get to a dose that they can actually get at the regular pharmacy, and then they switch.
You want to grab the insurance company one?
Yeah. So what do I say when I call my insurance company? So basically, you need to find out if they cover these medications at all and what criteria they need to cover the medications. Sometimes they will only cover them for certain diseases. So if you don't have type 2 diabetes, they're not covering this for you at all. They might not cover Zepbound or any weight loss medication, period. Yes, for Monjuro, they might cover it only for type 2 diabetes. They might not cover Zepbound or Wegovy, period, no matter what you do. They might cover them, but you may have to fail like 3 or 4 other medications first or have a contraindication to them. So usually you just call them and ask them those questions and see what they. Sometimes they won't tell you anything. And then we suggest you call back and talk to somebody else. But yeah, sometimes they just won't tell you.
Yeah, sometimes they're like, well, we can't give you that information. And I'm like, so call back and find someone else who actually is helpful. Would it be easier to do Zepbound than getting the PA from Mounjaro? If you can afford the $550, because the PA from Mounjaro, unless you have diabetes, is likely not going to work.
I think it's the same thing. Call the insurance company and see. Yeah. They might cover it for something that you have, and then it will be covered.
Right. If they'll cover it for like PCOS or something off label, then they might. But again, like each decision is a risk benefit. Is it worth paying us $75 to do a PA? Or do you take that 75, put it towards your medication? And I'm not saying like we hired somebody to do these. So in period, and I had somebody, like I said, when I had my first push provider, I had her do a PA, $150 later. Cause I was like, I didn't know any better. I didn't have somebody to tell me, listen, it's not going to be covered. All they do is leave it in denial apply the coupon, and then you get the $550 price. That's like, you don't need a PA to do that. That's what I didn't know. And that's what I wish somebody would have told me $150 later. And because if somebody said like get a PA today, like, cause if I went to Walgreens is notorious for this. If I went to Walgreens, even HEB, HEB kicked it back, my Zepbound prescription, kicked it back and said I need a PA. Not like nothing else. I'm like, I'm not getting a PA. They're not going to cover it. The plan doesn't cover it. I have a crappy insurance plan. They're never going to cover obesity drugs ever. So if I were to go get Zepbound, I would go and bring that coupon in. If you're comfortable with compounded medications, that's probably the easiest. That's why I haven't done it yet. Because if I can pay, because I'm on 5 mg, right? So if I can pay $250 a month instead of and not have any stress of having to call insurance, get the coupon, argue, have the stigma of standing. That was always my fun part with Manjaro, is having the fun part of standing at the pharmacy, getting these drugs and having them look at me like you're stealing them from diabetics,
Well, and the stress of finding your dose. Maybe they just don't have it. We're starting to see more and more of that lately, unfortunately.
I know, it's very frustrating.
Been doing a lot of resends again.
Yeah, and I looked at the shortages, the Manjaro, it's tirzepatide shortage. There technically are no Zepbound shortages. It's all Manjaro shortages. But we still have some people that their insurance is covering Manjaro if they were on metformin before, that they're still covering, which is amazing. Pamela said on 2.5 tirzepatide, second injection, day after, no appetite. Since appetite back, will that get more suppressed? Explain that question for me. Like, you have an appetite and then it goes away, or you're on the second week of 2.5 and your appetite is raging again and you need help?
Anyone having luck finding Wegovy 0.5? Probably not. In isolated pockets, every once in a while, a patient's like, my pharmacy has it, but they're like few and far between, and it's probably old stock.
And not reliable. And that's the hard part. These are not drugs where you should be going willy-nilly back and forth. Like, even today I read something, I think it was on the last thing, with the, what's the equivalent dose of? There is no equivalent dose that we know you can tolerate. It could get real ugly if you went from one or the other in these equivalent dose charts that are out there. Thank you, pharmaceutical companies, for doing that. Who did that chart? I'm angry about it.
Someone did it, and it was. I think it's for glycemic control, so it makes sense for that. Wow.
Guess what? We got a hater. Nice. This channel is boring.
Like
okay, I'm good.
It's for glycemic control. It's not for side effects or appetite control. It's only for glycemic control, and people are using it. And man, I can't imagine switching from like 5 milligrams of like Manjaro over to like 2.4 Wegovy. Like,
no,
that'd be crazy to me.
Yeah, you'd be terrible. Yes, cool. Dr. Jen, I use the coupon for Zepbound and pay $5.50. Yep. As long as you have commercial insurance, you can use that coupon. Mm-hmm. Some comments have been filtered to protect. I want to see them.
I do too. Jeanette went from 10 of Manjaro to 10 of Zepbound. Yeah, they're equal. Yeah, you can just go back and forth between Manjaro and Zepbound, whichever one's cheaper or the better for you, or your insurance covers. Or even if you switch to compounded, you literally can just go straight to 10 milligram tirzepatide compounded.
Yes, Dr. Jen, is it not like the best thing ever? Like the best thing ever. You're like, oh my God, like this is what normal people feel like? Is taking Wegovy with MS okay? We have patients who have been able to decrease their MS meds because of the anti-inflammatory effects of these GLP1 medications. So it's pretty cool.
I mean, that would be incredible if they studied it for that and it works to slow the progression of it even more than what they are doing now. Nothing.
Yep. I want to know it was filtered. I'm like, come on, I don't want to see. Let's see. Yeah, so Manjaro, Zepbound, and tirzepatide are all equivalent drugs, like equivalent names for the same thing. Now, Wegovy, Rybelsus, Ozempic, and semaglutide, I can't do that fourth finger, are all the same thing. I'm like, this is a weird thing. Like, nothing was working with my hand. So when you switch from a tirzepatide to a tirzepatide, that's an equivalent dose. If you go from semaglutide or liraglutide to either, another drug, tirzepatide or whatever, then I'm sorry, I'm laughing at my comment. I gotta move that chat out of there. We gotta. This channel is boring. I appreciate the feedback. Um,
Oh, you also got. Are you a real doctor from her?
oh, I did. Where is that?
It must not have popped over because I can see I have YouTube pulled up and it's there.
Okay. Was it from him too?
Yeah, from Babar.
Uh-huh. Well. Okay. Well, I haven't
Fabric.
answered that question yet today, and it'll be the 3 for 3, so we'll do that in a
Yeah.
minute. Um, has my rheumatoid arthritis in remission. Like, is that not insanely amazing? Like, it's RA. Like, this is no joke. The drugs that keep that in remission, the risk benefit for those drugs is ridiculous. Like, I can't, whatever. Anyway. Um, ooh, we got lots of comments today. Am I a real doctor? Yeah, the short answer is yes. Um, I'll do more later if we get a lull, but we got to finish at 2 today because we have the food noise is so bad without the meds. Yeah, yeah. I can't go. I tried 2.5 because I had a 2.5 pen and I thought, oh, I'll be fine. No, you're not fine. You're so not freaking fine. Like, there is nothing fine about this. This is a mental health drug. Like, I can't. My brain's nutty anyway, but without it, it's crazy. Um,
Lisa's doc gave her a prescription for Zepbound 2.5 because I was on compound, but it's been 2 months since. Yeah, I mean, if you were off compound for a couple months, I'd probably, especially that long, and you didn't go up very high, I would probably start you at 2.5 as well. Some people actually that dose starts working for again. Some people, still need to go up.
Hey, Krista, is there a month's way to get months worth of medication at a time? If your insurance will cover 3 months, then we'll do 3 month, like a 3 month kind of care plan. So you still are with us for 3 months, but we will do that if your insurance will cover for 3 months. With compounded, there's no way to do it because with the vials, once you puncture, it has to be used by 28 days. So we can't do in the beginning. We could do 8, 10 weeks, 8, 10, 12 weeks of one vial, which was awesome. But doesn't work anymore, which is great for like the semaglutide people because they could you could get that for 100 and something a month, like super cheap.
Oh, yeah.
So, I mean, super cheap, right? It's relative. It's not metformin cheap, but it's, doable.
When I first filed semaglutide, I think I paid like 160 for it, and it lasted me like 14 weeks.
Mm-hmm.
That's cheap. That's cheaper than any bottle of like diet pills and
Right? Those
Benadryl
fat
and
burner things,
stuff.
I've
And
paid a
it
lot
actually
for those.
works.
Yeah, did you pin Kim's comment? That was a good one.
Oh no.
Oh, Janet did. Yeah, so I bet. So can you be on Wellbutrin and ADHD and take these meds? So let's address the mental health. Hold on.
Favors, I love it.
Oh, he's such a hater. That's fantastic. Wait a minute. 4 viewers. Well, I got 70 on TikTok, so there's that. Anyway, we're getting harassed. And that's what we get for asking for haters, for God's sake. Hey, wait a second, though. Neil, we have some rando on YouTube. We never
Yeah.
get views on YouTube.
No. So thanks, Bradley.
Heck yeah. You're amazing. Send it to your friends. Keep it up. Seriously. Okay. All right. Let's go back to this. So the mental health elephant in the room here is you need to pay attention. There have been studies on suicidal ideation on GLP-1s. Making an educated guess, think it's because it changes our relationship with our lives, our body, our food, and our primary coping mechanism. Or God forbid, you have a different primary coping mechanism that shuts off the dopamine hit that you get from that thing. Like last night, because like I said, I took 7.5 because sometimes I just need to break the cycle, and I had a 7.5 that had just expired, so I thought I should probably use it. So I was in Whole Foods and no meatloaf. This was before the chicken fingers. And I walked by chips and salsa, which is a huge problem for me. Like, not even that I didn't like, it was neutrality. It was an aversion, which is like a different, that's a mental thing, right? It wasn't like, oh, like I don't have to be hungry to eat. I don't know what hunger and food are even like, why they're not even related in my life. But my thing is, you have to watch what happens mentally. Now, it also does slow your gut. Oh, somebody had asked before about gut slowdown. It does slow your gut so that your medications might absorb differently. So if that happens, you need to stay in touch with your psychiatrist to make sure that you're not like getting too much med in. But again, it's tough because right, these meds give us insight sometimes when we don't have it, and it's tough. So yes, the short answer is yes, you can be on psych meds, and I say psych meds. I know you got to remember, I am an actual doctor. But you can be on psych meds, and you can be on any medication with these for the most part. I mean, are there any true contraindications medication wise with them? None that I know of.
No, no, there isn't. But we haven't really seen a lot of because they mentioned like birth control pills, blood
Oh
pressure
yeah,
pills,
sorry about
and
that one.
antidepressants. That's the only real one we've seen, and I don't know if it's actually the absorption of the birth control pills or it's more just the regulation of hormones allowing people to get pregnant. But for antidepressants, really haven't had anybody really have to switch. We have somebody on lithium that their level has stayed stable while on the medications, and the therapeutic window for lithium is very narrow, and it stayed within limits. So that was
Oh, good.
that's great. And really haven't seen it for blood pressure medicine. The only thing we're really seeing with blood pressure medicine is people coming off of them because they've lost so much weight they don't need them anymore.
Which is amazing. Yeah, yeah. Don't forget the backup contraception. This is not medical
Yes,
advice. Don't forget. But we all know that you're going to forget the condom or it breaks.
you
So
are. Yeah, go get an IUD, get the implant
get the implant,
because you're
get an
going to forget the
IUD, get
condom or
some.
just not want it.
Jenna, are you a real person? My depression was way better, right? Like not having the food stuff, living in my own skin. Like, yeah, it seriously helps. But the gut slowdown, we'll do a super short thing. Side effects hitting hard. Yeah, no joke, huh? That 7.5 is like, okay, I'm the green face emoji. Okay, we're good. We got this. That's why I'm sipping golden pineapple kombucha to settle my stomach because I'm like, we feel terrible. Now, do not eat Cane's chicken fingers. Okay, don't do that. Um, which actually
So,
tells you something. Which tells you something good about this that you can mitigate side effects with behavioral change. But vomiting is never acceptable. I thought I was going to throw up overnight. I thought I just need to get rid of these because they're not going anywhere. Is there any? Oh, this is a great question. What are you laughing at?
Babber, I love it. You ate
Oh,
3 whole chicken fingers. I just
I know. Yeah, hashtag not a Manjaro. Um, I know, seriously, but okay, so here, 3 whole chicken fingers. Yes, seriously. I could easily have eaten double that, probably triple that a year and a half ago. No problem. No problem. Especially stress eating. Oh yeah. And then I would have hit the ice cream and then I would have gone back and forth because you have to go back and forth. So anyhow, let's go. Is there any evidence that long-term use is harmful if using for weight loss? This kind of, if we piggyback that with the question of would we prescribe it? I'm paraphrasing the question. Would we prescribe it with no weight to lose with rheumatoid arthritis? My answer is yes, we would. We prescribe drugs off label all the time. We're prescribing Manjaro off label for weight loss. So why would I not prescribe Manjaro or Zepbound off label for RA, being able to function, colitis? I have a very good friend who's on it for colitis. She didn't need to lose any weight, not anymore. She lost like 15 pounds. It was all stress weight. And 3 whole chicken fingers. This man does not know my history. Not a bit. It's an ugly ass food history. So we don't discriminate on the basis of you don't have to earn your right to take this drug. You do have to have a reason, right? Like I'm not going to I shouldn't say that. We do discriminate against people who want it to fit in a size dress for a wedding or something stupid. Right? Like now granted, you might be going to a wedding, so I'm going to start it now rather than later. That's different. So anyway, but any long-term use is harmful. My whole point of this is it doesn't matter why you're using it. It matters long-term use harmful. And these drugs have been out since 2000. I always look at the clock when I say it. Like I always look at the date. It doesn't tell me what year it is. Since 2005.
I'll piggyback on that. We're now not totally discriminating against people who want to fit in a dress. We have lots of people who want to look good for their son's wedding in 12 months and they want to lose, some weight, 60 pounds, 40 pounds, 30 pounds. Like they're already obese. So this, at the end of the day, this is just going to help them be healthier long term and live longer. But yeah, they do want to just look better for that wedding.
Well, we
but not
did
a size
have
zero.
we had right. We had one patient, and not to mention you wanna show up at family events as yourself, right? You wanna show up in your own skin, proud of who you are, and I'm not saying you have to look like Cindy Crawford, don't ask why she came into my head, 'cause I'm old. I was, recently in a TV show. So, but don't think, like, you wanna show up differently in your life, and whatever motivates you to get there, we're kinda good with it. Now, we did have someone who wanted to lose weight because she was having a mommy makeover, and she wanted to lose it before then. I thought that was a great idea, because not to mention going into surgery with less adipose tissue is gonna be helpful for general anesthesia, complications, and better outcome in surgery. I have 36 new messages, I'm just gonna scroll.
I'm going to hit this one. Issa, I've been battling the same 3 to 4 pounds for 6 weeks now. I moved up to 10 milligrams of Zep and no weight loss. So this is where, if you're not having appetite control at all, it might be worth going up again. Unfortunately, we've had patients where they went up to 10 and actually wanted to go back to 7.5 because they had better appetite suppression there. That's option one. The other thing is you need to look at kind of what you're eating and the rest of like our 5 pillars, like movement, hydration. Are you getting in enough protein? We typically aim for about 100 grams of protein for our patients. Hard for some people. What else? Getting enough sleep, 7+ hours a night, and like minimizing stress. That's a good place to start to kind of get you going again.
Sandy asked, would you start a GLP-1 to lose 15 pounds? Me personally, absolutely. Because the question isn't how much weight I have to lose. The question is, why can't I lose it? I've been fighting food for 45 plus years. I'm kind of done. Oh, Bobby said I need it for surgery. They still won't approve. Oh, I'm not saying insurance will approve it. They're not going to approve anything. They would rather approve bariatric surgery than these medications because it's cheaper for them.
Tamara, I'm searching for a reasonable price for terzepatides. It's crazy prices out there. Yeah, so I mean the if it's compounded terzepatide, the pharmacies kind of set their own price. Some are a little bit more expensive than others. Some give providers a little bit better price. I think with SLC, if you buy it yourself, it's like double the price that we would pay for it for you. So we typically pay for you, and then they ship it to you. But any provider can change those prices all they want. So you're more than welcome to kind of see our prices. If you go to amstelehealth.com, click become a patient, we can talk about it. But I think semaglutide starts around 150, and I really need to look. Tirzepatide
I'm looking.
starts, around 2-ish for the
150
first one.
150 for semaglutide, depending on your dose.
Yeah.
What's 2.5? I'm like, hold on, I can't figure this out. 200 for 200 for tirzepatide, 150 for
Okay.
semaglutide. Yeah, about there.
Yeah. I think
Not
price-wise, I
bad.
think I think we have great prices to pass on to our patients, and after looking at pharmacy after pharmacy.
Yeah, and when you get up to the higher doses, ours do get pricey. Mochi will do the way they do their cost is their prices don't go up. Like tirzepatide is like $400 for the medical care and the compounded prescription, regardless of your dose. We don't do things that way. It's just we choose not to. Same reason we charge for prior authorizations. I don't want you paying for somebody else's prior authorization. I don't want you paying for somebody's high dose of medication either. Does Manjaro help with fibromyalgia pain? We discussed this the other day, that it does reduce your inflammatory markers, but I don't remember what we found in the studies. We looked at it and I don't remember. You weren't on that day. You were working, I think. Because we
Me?
gotta yeah.
Yeah. Got to work Tuesday. What's up with that?
I know, right? What was that? I'm like, where the hell's Neil? Working. I don't know. My thing is, so Britt said she wouldn't recommend it for that small of an amount. But the point is, like, nobody finds me by accident, right? So
Yeah,
if
but
you're looking, like, I don't know, what have you tried? What have you done? Have you done the things? Because for me, I've been trying for 40 years and I'm freaking done. So I don't care if it's 5 pounds or 55 pounds. I'm done. I'm just done. I'm done fighting. I'm done fighting my biology. Um, yeah, Wegovy's always going to be out there on shortage. Now it's 550 and not covered because I'm not a high BMI. It's chronic weight management, so it will probably require a prior authorization, but I would call them and say, "Here's where I started, here's where I am. What are the clinical criteria for coverage?" It may just not be covered anymore. They changed their formulary. Somebody said, "Why do some people get sick on GLP-1s?"
Oh, there's lots of questions like how to get rid of stomach bloat, and then there's what helped them nausea the most. So sometimes it's just looking at the foods you're eating or the quantities of foods you're eating. Some people just can't eat the same foods that they ate off the medications, and it doesn't necessarily have to be like those chicken fingers. It could be cruciferous vegetables like broccoli
I
or
get totally made fun of for
cauliflower.
that.
You just can't tolerate anymore. Yeah, or like red meat. Some people just can't handle red meat while on the medications, or at least in the beginning, because it just sits in their stomach for so long. So typically it's, for nausea, some people just get nausea and it's part of the medication initially. You just got to look at when you're getting the nausea. Is it first thing in the morning? It probably means you ate too close to bedtime and that stuff sat there all night. Or is it right after a meal? Maybe you ate too much. So thinking about slowing down the eating a little bit and let the medicine kind of catch up to you. And then, yeah, a food diary. Look what you're eating.
Oh, it's so okay. Neil, you're hard to hear.
Oh boy.
I know.
You got to turn me up.
Turn you up. You need it. So go follow Neil Hyzak FNP on TikTok because that's why he's not on here with me on his face. Because nobody loves him. No, just kidding. Britt, no. So this is the question that Britt asked. I get that, but for such a small amount, will they stay on it long term or just to lose that? So I think that's twofold. It depends on the person. If they say, for example, they had a stressful experience in their life and they gain the weight and they can't lose it, or the menopause thing, I use air quotes. Yes, I get menopause is a real thing that does require treatment. But everybody blames menopause when it's really just it's a hormonal change and a slowdown with stuff. Not bad, a little echoey. Okay, good.
Yeah, what kind of doctor are you?
I'm getting there. I'm getting there. I'm not done with Britt's question. Um, so for me, if I only had 15 pounds to lose and I got here and I felt the way I feel, well, not right now because right now I'm nauseated, but when I felt the way I feel mentally, I would stay on it. Like this would be a long term thing. Now, you ask me how long is long term? For me, if you ask me to make the decision today, it's forever. If But we don't know if 5 years down the road you have enough metabolic repair so that this brain signals have righted themselves. I have heard people like, "Oh, you only need to stay on it for 18 months." I'm like, I'm there. My brain's still a shit show. So maybe for me it'll be 5 years. Maybe it's like 1 year for every decade. I don't know. I think it depends. But yes, if they're just going on it to lose 15 pounds for like a whatever, like that's just kind of dumb. Like I don't know why you would make. Oh, Neil Hyzak. And Neil, put your name in there.
Yep.
Join Fridays is here. I just liked one of their posts. It was great. It was the Biggest Loser. It might have been a live. I don't know. It was on when I came on. But yeah, totally. Yeah, if I was going to gain it all back, and a lot of us do. In the studies, they use the same interventions with placebo, and people gained it back. So, which tells you it's not willpower; it's biology. You got to push the rock uphill. Like, how much effort do you want to use? Oh, look at that. You're pinned, Neil. You are pinned. Yeah, that's why I said no. Brit's got the right of it. That's the distinction. Is this a long game or are you just doing a quick fix? If you're just doing a quick fix, fen. Just kidding. Don't do fen. I don't like fentermine, but
You have to go to another country to get that.
I know, right? It's all right. They're getting it from other countries anyway. Other crap here. What kind of doctor am I? Primarily trained in emergency medicine. That is my primary board certification. Currently studying for both obesity medicine and lifestyle medicine boards. I run a lifestyle medicine practice called Active Medical Solutions at amstelehealth.com with 6 other providers. And Amanda's on the wave. Hold on.
But I can't. Oh, there I am.
So now you have Amanda. Amanda, how many followers do you have on TikTok? Okay, follow Amanda Luby. I need you to get on TikTok and put your name on there so people know to follow you.
I am. I just don't know how. I, I'll look that up.
We're doing remedial social media today. So Amanda is on where to go to medical school. It's a good question. It's funny. It's only funny because when we started, it was the Medical College of Ohio, MCO, in Toledo. When we graduated, it was the Medical University of Ohio in Toledo. Now it is the University of Toledo College of Medicine in Toledo. So usually I just say Toledo. So we were actually going to go to residency there. Went for an interview in Tampa, Florida in January from Toledo, and went to residency in Tampa because it was on an island with palm trees and a Starbucks in the hospital. Okay, I never want to go home. Well, which was good because it was residency and I didn't. So that was fine. So yes, Toledo for medical school. Kalamazoo, Michigan for graduate school for athletic training. Tommy's got a good question. Somebody else field this. Explain breathing. Is it voluntary, involuntary? Depends if you're a dolphin. Dolphins have to stay awake. They have to keep half their brain awake to breathe because it is not an involuntary action like in humans. There's my fact of the day. And did you know that pelicans hit the water at 40 miles an hour and they have clear eyelids so they don't go blind? And all of their organs, they always dive to the left, and all of their organs are on the right side of their body. Thank you, Ranger Rob, if you're listening today. Their organs are on the right side of their body, and they have air pockets to balance the weight so they can fly, so they don't have internal damage when they hit the water at 40 miles an hour. Don't ask me silly questions, because, man, you're going to get lots of information. There's a lot going on up here. So it's involuntary. You just can't stop. No, you can't. Now that's why you get the mammalian diving reflex. Like if you try to drown yourself underwater, you will actually breathe in water and die because you can't stop breathing. Your biological drive. So this is a good thing for weight loss, right? Your biological drive will override willpower, like we joked about in the ER. Just breathe, dude. Just breathe. You know, when we have to actually put an airway in and breathe for somebody, you can't just tell someone to breathe, right? They're either breathing or they're not. So if they're breathing, you're not going to stop that breathing by willpower alone. If you're binging, you're not going to stop that by willpower alone. So it's a great question. And got lots of bizarro information.
Learned a lot about pelicans.
The brown pelican is I think the smallest species of pelican, and those mothers are huge. They're wonderful. I heard Kalamazoo. Yes. Yes, I went to grad school in Kalamazoo. Feel free to sing it. If you don't know the song, look it up. Because every time I say it, even when I went there, I went to Western for grad school in athletic training. Oh yeah, I'm also a certified sports nutritionist. I was certified as a triathlon coach I was an ATC for 26 years. I let that certification go, but still have all that useless knowledge in my brain. It's not useless. I love ATCs. But yeah, I was certified with 2 organizations as a triathlon coach. Oh yeah, I'm a life coach too. You're welcome, Tommy. Bronzer Borges. No, I was like not medical there. We actually interviewed there because I love Kalamazoo, so we interviewed there like 3 interviews for residency. But no, I just did. I did emergency medicine residency in Tampa General, warm, not Kalamazoo. And although I love Kalamazoo, man, the palm trees got me. So yeah, I'm primarily certified in emergency medicine, but my practice is lifestyle medicine, and I'm studying for lifestyle and obesity medicine boards. How long after a telephone call do you get the meds? So we do our care by what's called asynchronous telehealth, 99% of it. Oh, that's a great question. So you'll get a text from our team, then you schedule a video visit, but the video visit does not have to happen before. It's kind of at the same time. We schedule the video visit the same time you're getting your care already. So if you if you go to AMS Telehealth, click Be a Patient. What time is it? 1:45. You'll get an email back, or you'll get intake forms emailed to you. You fill those out. You get a text from us. You get started. You can get started probably within 4 hours, which is pretty freaking amazing.
And had a patient that I did the video visit with the other day who got their meds in 2 days.
Like from us to...
Yeah, so we started the text conversation. They ordered meds that day, and they got them 2 days later.
That's incredible. That is absolutely incredible.
Yeah, started on like Wednesday, got them on a Friday. It was unbelievable. Because I'm like, oh, so you should be getting your meds soon. They're like, I started this morning. I'm like, oh, wow.
That's amazing. Oh, Tommy's in Naples. Yeah. So Tommy, if you want to be on GLP-1s, go to amstelehealth.com. My heart lives in Florida. My body lives in Texas. um, my brain kind of splits the time. We do have a condo in Fort Myers Beach. We were just there. But my family's dragging me to the snow for oh, I don't know what to do with that, Amanda.
I don't either. That's why I sent it to you.
I know I need to know your name because I can't use my phone. I'm TikToking on my phone.
So
Amanda sent me a QR code.
it's got an at thing, and it also has a name at the top.
Is that it? Is that your TikTok? When you sign in the villages, hey, we got lots of Florida people. No, we actually have our condo is in a condo hotel, so it's all taken care of, which is freaking nice. Well, it's supposed to just freaking nice after Hurricane Ian because it's not in Sarasota. It didn't get washed away into the bay. What are the costs of the higher dosages of terzepatide? When you get really high on terzepatide, that sounded funny. You don't ever get high on terzepatide. When your dose goes high on terzepatide, um,
Towards the maximum.
toward the
Yeah, when you get to
maximum.
like
Yeah.
12
When
and a
you
half,
need
15,
a higher dose for it to be effective.
Mm-hmm.
Like
yeah,
me.
when you get up there, it's a lot of times, depending on the state you're in, it might be actually cheaper to use the coupon savings card and get brand name Zepbound Monjuro. Zepbound.
Yeah. Yeah. Because if you're
You'll
on
start to get,
15 milligrams, you need 60 milligrams to get a month's worth, right? Mathing. To get 60 milligrams, you're looking at $500 if you're in Axtel states.
And we need Axel to start shipping to Virginia. We need to talk to
I
them.
know, 610. Yeah, it's like 600 for a lot of our states.
yeah.
A lot of money. Unless you go with Texas Star because it comes by 10, so you'd have to order 6 of them, which is more than the actual retail
Yeah.
without the savings card. What are they doing? Whatever. Nothing productive.
I'm gonna hit Frank's question. I took week 2 Zepbound on Sunday and I can't eat anything. Like I don't want food at all, but I'm dizzy. So the dizziness, it might just be from some dehydration. A lot of times you're not eating, you're not drinking as well. So I would start there, and I would start with like an electrolyte drink, Body Armor Light, Gatorade. If you're not eating anything, I would probably do regular Body Armor Light at this point, or regular Gatorade, get a little bit of sugar in you. That might make you feel a
Or
little bit
coconut
better.
water. Coconut water will
Coconut
do really
water,
well.
and then very small, frequent meals. Like I know you don't want to eat. I'm talking like
A
a
bite or two.
piece of beef jerky, an apple slice, like
Like one apple
very
slice. We're
minimal.
not talking
Yeah,
like and a lot of times people will say, "Oh, I'm eating that." You're just not eating like you're used to
yeah.
eating because
And
what
my
you're
first
eating is in
good.
your mouth is coming off your butt. So
Yeah.
combine those
My,
two.
my first week or two on semaglutide, I was probably close to 500 calories. It was a little better week 2, but I was struggling to get food into myself, and I would just focus on protein. And I was drinking a lot of the Core Power 42 gram protein shakes, and that's kind of all I was eating.
Which is kind of gross, but I got it.
Yes.
10-minute warning. Thank you, Linda. We have a patient live, so we'll actually have to get off here. So let's do this. It's really hard to eat. Yeah, for sure. Make sure you're not on too high of a dose. Yeah, disease really, it's got to be the dehydration. Now, let me lie. This is not medical advice. You need to make sure that it's not something else, like a cardiac arrhythmia or something in your noggin. Like, I get it. It's probably dehydration. Most commonly, this is not medical advice. This is advice to see your medical. So, if you do the hydration stuff and you're like, yeah, it still feels like crap, you need testing. You need heart
Yeah.
workup. You need a brain workup. You need a workup. Any info about Trulicity, the good, the bad, and the ugly? It's what my insurance will cover. Go with it. Try it. See
Yep.
if it works. Add some metformin on there. Talk to your provider. I keep wanting to say Lucy in the Sky with Diamonds.
No, we've had patients that have good success with Trulicity. If it works for you, great. Patients losing way more than the studies say they should. So it might just be really good for you. And sometimes, let's say you fail at it, doesn't work. They might cover something else because you failed a medication.
The Frank's stuff about really doesn't want to feel like eating. That's like what I feel like. What I feel like right now is what I felt like when I started. Because it wears off after months, and when I started, it felt like this. Like I had no interest in food,
How much
which
did
is
you
the
take?
in 7.5.
Okay.
I didn't do the 9 point the week I did the 9.4, it was like totally fine. Because it was a really bad time then. So this wasn't quite as bad. So again, I got to balance the stress, and you know, stress has picked up a little bit this week. So that's a little bit more of an appetite suppressant, which is not normally me either. Normally I stress eat. This is a stress not eat, which is again very different for me. Yeah, best GLP-1 is the med insurance will cover. Then that you can tolerate. Preach right there. Because now, which one is actually better? Truly, the best one out there is tirzepatide. And nobody can deny it. It's the studies. I know it's my favorite. Get
No,
metformin.
in the studies it's way better. I mean, we've had people lose absurd amounts of weight on semaglutide or Wegovy, but
Mhm.
average person, Manjaro,
Well, it's a long
tirzepatide,
game,
better.
right? So if you're like, well, yeah, but over 60 weeks they only lost such and such. Oh, when somebody asks, will people be on it forever? Um, it's that we're playing the long game, right? Like, so if it takes you an extra 3 months to lose the weight, but insurance covers Wegovy and you can get it, that's the caveat. Novo Nordisk cannot keep up with demand. Period. Neither can Eli Lilly for that matter. There are, well, it says tirzepatide. It doesn't say, I think it's all Manjaro. Sorry. Yeah, because I looked yesterday. There's like 3 different strengths of Manjaro that are officially on shortage. So 1.8 pounds week is good. Yep. That's fantastic.
That's amazing.
Yeah. I mean, in a year, you're down almost 100 pounds. So yeah, it's great. Yeah. If I fail, I get something else. Really, the next step would probably be semaglutide compound, to keep costs reasonable with metformin, to see if that works. If you're comfortable with compounded, we don't push people like you can do what you want. So somebody go check and see if A Luby is Amanda Luby on TikTok before we go.
Well,
Somebody go over. Somebody
Well,
go
so
over and tell us and let us know.
it's got the at one says AMS Luby, but the
We need to
top
know which one.
A Luby
Uh,
here.
Neil, you got to look at Kimbo Slice.
oh, I
Her
saw
name is,
Kimbo Slice. I love Kimbo Slice.
that's
AMS Luby.
fantastic. Okay,
That's me.
so all right, so it's AMS Luby.
There
But
she
then at
is.
the top it says A Luby.
Doesn't matter.
So
It's
I
your
don't know how
name.
to find me.
Well, it's the at one.
Okay,
AMS Luby.
yeah, that says AMS Luby.
Hold on. What did people just say? What
And
did we
I
just
had
ask?
10 whole followers.
It is.
How many do I need?
Okay. You need
1,000.
1,000 to go live.
A couple more.
Got more.
We got a minute to go.
I'll work on
Kimbo
it.
Slice.
I know we
I think
always
I'll probably
Neil
need to
gives
make
everybody
those.
nicknames. So Kimbo Slice is amazing.
That's it. You have a surgeon named Tim that I call Timbo Slice.
Not to his face, you don't.
Yes, I do.
Do you really? Oh, that's fantastic.
Oh,
Uh,
Emma followed me.
Aw.
Thanks,
Emma's
Don't
Emma.
our
forget
front
to
office.
follow
Okay.
me.
So the
Please. Keep
doses of
begging.
Manjaro on shortage. You can just Google FDA drug shortages and then type in the name. Manjaro injection, limited availability through early March, 10 milligrams, 12 and a half, and 15.
Yep.
So that's where we sit. All right, guys, gotta go because I gotta get the private live up. If you 2 minutes, Linda's got us going. If you want to be our patient, go to amstelehealth.com. If you're not in our states, we've got links right below the Be a Patient for Nikki Baldwin, who's nationwide, except for California, because she has elected to not treat California patients. But I have Maribel Campos below that. So we got people for you. Just head to AMS Telehealth and somebody there can take care of you, which is pretty cool. Somebody we trust. All right, guys, I'm going to go on the TikTok. We're going to leave here. Yep, end the live. All right, and then we had 1,000 viewers today with 2,500 likes.
Nice.
So much better than yesterday.
Does this do stuff?
Yeah, I
No.
think yesterday picked up after the first hour. Like how many patients were coming. because I think more and more we're following it.
This one was only 55 minutes, so the second day does better. That's interesting. Well, I'll have Faith do all that crap. It's her job. All right. So, anything else we need? We have like 2 minutes. Anything else before we go to the patient live?
No, are we staying here? Or are we going to switch to the Zoom?
We have to switch to Zoom.
Okay, that's what I thought.
Yep.
I'm glad Babber came. Babber was fun.
I know, right? We got a hater. It was awesome. And who knows how he found us, which is great.
A hater?
Yeah, I literally asked for a hater. I'm like, we don't have any haters, and literally he shows right up.
I was like,
on command.
Were you
Universe and I are like this. Okay, let's go. Let's go to Zoom. Let's go meet our patients. If you're not our patient yet, remember, head to amstelehealth.com. Hit be a patient. Even if you're not sure, you can talk to us. It's no charge to talk to us. Obviously. All right. We will see you on the public lives next Monday.